Okay, so I hope you can hear me on this. Today we're going to do zinc citrate. I might have done this a long time ago. I just finished this up. I got COVID last week, so I decided to amp up on zinc a little bit. Generally, I looked up the possible side effects, or not side effects, you can tell I'm still recovering. Still can't get my words. Brain function, antioxidant enzymes, and immune system. So with depression, there seems to be a use in adjunct to SSRIs, and it helps out with that. Testicular function, it seems to improve sperm mobility and motility. I think that's the same thing. Also, it can temporarily increase your testosterone, but again, if it's just temporary, it seems to be not a big deal. So when I say temporary, I mean like a few hours. The same with human growth hormone. There's a lot of people who, say, hey, this will increase this, increase that. But I guess with human growth hormone, it has to be amped up for a while. So all night when you're sleeping, for example, that would be one time. But back to zinc again. Also, you can use it for skin stuff, acne. So if people are having difficulties with acne, they can try zinc. I tried this one. Again, I don't usually plug, especially this one, because I don't really know it. But this is 15 milligrams, which is what you need. It says it's 138%, 36% of the daily, but not too sure about that. I think depends on the standards you go by. I chose zinc citrate, not zinc sulfate, which is the most common for a zinc deficiency. I chose this one because at the time I was trying to get oxalates out of my body. I was really afraid of oxalates because I was having a lot of muscle, like arthritis issues. I don't have an oxalate test, organic acids test over here, so I had to do it by guessing. And I took this for a while to supplement, and citrate, anything citrus, seems to be really useful for breaking down oxalic acid in your body and making it easier for your body to get rid of. In other words, less painlessly. If anyone's had oxalates, or if you've had kidney stones, you'll know what I'm talking about. Again, this is really good for your immune system. I can go in here and check. I've got a little bit more time. It says optimal testosterone levels. By the way, the only thing I want to say is you can overdo it. Copper and iron can get depleted, but that's the least of your worries. It can be pretty detrimental if you take too much for too long, and I can't give you the parameters on that. But if you're taking 50 milligrams for months, you're probably going to run into some problems, not only with copper and iron deficiency, but also with it getting stored in your brain, actually causing oxidation. So, the potential benefits of supplementation with zinc are largely dependent on the individual zinc status. That, I would say, is yeah. Supplementation with zinc is unlikely to provide benefit if your zinc levels are already adequate. Remember, you can get a shit ton load of zinc and B12 from oysters. One exception to this rule may be the case of respiratory tract infections. So there you go, you have another one. But it is an infection, which is the immune system, in which supplemental zinc has been shown to reduce the duration of illness. Supplementation with zinc has shown improve severe acne, depressive symptoms, testosterone levels, sperm quality, glycemic control, blood lipids, and especially people with chronic disease. Okay, that was a lot. So I will talk to you guys next time. Hope this is helpful to somebody. Remember, don't overdo it.